Busting bugs this winter needn't mean antibiotics. Most coughs, colds, fevers and sore throats get better without them, and overuse can cause more problems. So your GP will only prescribe them if they're really necessary. Find out more by downloading the Healthier Together app. It'll also let you check your child's symptoms so you know when to seek urgent help and when self-care is the safest. The Healthier Together app, your little bug buster.
This is the North East and North Cumbria Providers podcast, highlighting the fantastic work taking place across the region to provide the highest quality of care.
Hi and welcome to another episode of the Providers podcast. I'm your host Harry Newhouse, Communications and PR Officer for the North East and North Cumbria Provider Collective. Today I'm joined by a very special guest, Daniel Elkeles, Chief Executive of NHS Providers. Daniel recently visited several foundation trusts across our region, including North East Ambulance Service, South Tyneside and Sunderland, County Durham and Darlington, University Hospitals Tees, and Tees, Esk and Wear Valley's NHS Foundation Trust. We'll be talking about his impressions from those visits, the role of provider collectives, and how the NHS 10-year plan will shape the future of healthcare. Daniel, welcome and thank you for joining us.
Hello, Harry. Pleasure to be here.
Before we dive in, could you start by telling our listeners a bit about yourself and your journey to becoming Chief Executive of NHS Providers?
Yep, happy to do that, Harry. So you can tell by my accent that I'm a southerner. I've done my entire 30 years of career in the NHS in London and Surrey. So one of the things at my interview when I applied to be the Chief Exec of NHS Providers was, Daniel, you have to get out and see the rest of the NHS in the rest of England. So that's why I went and did a tour of the northeast of England and had an absolute ball in going to see all the amazing stuff going on in your part of the world. Before I was at NHS Providers, I was Chief Exec of the London Ambulance Service, which I did for 5 years. And before that, I ran an acute and community combined trust called Ep16 and Elkeles, which had one hospital in London and one in Surrey.
Brilliant. And so you mentioned there that you visited the North East. What were your key takeaways from visiting trusts in the North East and North Cumbria?
So my big takeaway is, I hope you realise how special the NHS is in the North East of England. You are the most coherent, consistent, high-performing, collegiate, collaborative group of providers I have come across in the NHS. And I think the people who live in the North East are very lucky to have you all as their providers of care.
Some very kind words, thank you. And what were there any examples of innovation or best practice that really stood out to you on your visits?
Absolutely, loads. In every one of the trusts I went to, I would say there was something that is totally brilliant. And I have been telling lots of other people about in my travels around other parts of the country. Okay, so Tees, Esk and Wear Valley Mental Health Trust, what the team there have done about linking mental health clinicians to primary care by having a senior nurse of mental health senior training in each primary care network is totally game-changing. So, and I've told everyone this is the right model of care because it means that GPs and patients get really quick access to expertise in the community for mental health. The support from the trust with the consultant psychiatrists has led to a big reduction in secondary care referrals, which has made their workload manageable. And then the way everybody works together in Hartlepool Library to create a complete community, which isn't just health, but everything you could want in a social setting in one building, totally phenomenal. So I think that's pretty brilliant. When I went to County Durham and Darlington, the work that the trust had done on renegotiating its PFI deals so that the PFI partner actually came good on all the things they were supposed to do to make their hospitals better, I thought was pretty impressive. And I've been telling people about that. Loads of good practice at University Hospital Tees. So we went to see the Friarage Hospital in Northallerton, which I think must be the exemplar of how to run a small rural District General Hospital safely and effectively. I saw an amazing elective treatment centre at the same in Northallerton too. And then the ED in North Tees, Stockton, I reckon, has got the best triage system of all of any ED I've been to, and that the triage senior nurse can navigate away from majors ED, best part of 2/3 of the footfall that comes through the door, brilliant. The way the medical takes works, brilliant. The focus on ambulance handover delays, brilliant. It was a really high-performing emergency care system. Then I went to North East Ambulance, and the work they're doing to get critical care ambulances to the right people, and ensuring the sickest patients get great care. Thought that was pretty good. I love the stuff that Sunderland Trust had done on digital and the level of HIMSS scoring they had got. Totally brilliant.
Some fantastic examples there. So how do you think the region's approach to collaboration compares to other parts of the country?
I think you're very advanced, and I think lots of other parts of the country should emulate what you do and how you do it. But I don't think you should rest on your laurels, because I think there's loads more you could do, and you could push the boat much further if you all guys all wanted to.
The work never stops. And obviously the NHS 10-year plan has recently been launched, and it sets out ambitious goals for the future. From your perspective, what are the top priorities for the next decade?
So one of the things that is very obvious when you go and visit the North East is the amount of deprivation and the amount of people not in work, and how the NHS is by far the biggest institution in the whole economy of the North East. And I think there's a lot of people who are not living healthy lives as they get older, which is causing them a lot of distress and causes the NHS a huge burden of care. And I think the big challenge for the North East is how do we do these shifts to community, the shift to prevention and the shift to digital at big scale for a rather younger population than if you had to do that in more affluent parts of the country like Surrey or Sussex, where I know better. And I think that is a huge task, which is going to require big join-up between the NHS and the rest of the public services infrastructure in the North East to make a real difference to those people and their lives.
How do you see provider collectives contributing to these objectives?
Well, I think you're doing really well at it, because it's all about sharing what is really good, deciding that you can't all do everything everywhere, and who is actually going to lead on what, because it's either in the best place or they've got the best skills and capability to make it happen. And realising that the future is all about collaboration, it's all about integration, it isn't all about little fiefdoms. And I think you're absolutely in the right zone in your collaborative now.
And you mentioned that one of the 3 targets for the NHS 10-year plan was the role of digital transformation and workforce development. What role will digital transformation and workforce development play in achieving these goals?
Well, I'll give you an example on the digital space that isn't from the North East or somewhere I visited. Right? So I went to a GP practice in Brent. So Brent's a London borough. It's massively diverse. It's got huge deprivation. And here is a GP practice who's managed to grow its list from 14,000 people to over 100,000 in 4 years, because they have completely sussed same-day access to care. And they've sussed that through digital channels. So they have an 8-hour response if patients use one of their forms to say, I'd like some support, some help, I'm not well, whatever. They've linked the form to the patient's medical record. They have a team of 40 pharmacists who answer all of these questions, supported by GPs. But because they've done the digital of the form comes online and they've linked it to the person's actual medical record, they're getting really good outcomes about what is the right thing for that patient. And I think in some parts of the North East, primary care is not as strong as it should be. And I think that's a really massive help that you could be doing by learning from Brent about how do you manage access, same-day access to care that doesn't mean everyone comes to ED.
And I suppose that's why it's important that we're not just collaborating as a region, but as national as well. So, yeah.
Well, I think that's a big part of the NHS provider's role, is to spread good practice from one part of the NHS to another, which is why I love getting out and about. And I've been to 42 places now on my travels in 6 months. So there you go.
travelling a lot of the UK. So are there any areas where you think the North East and North Cumbria can lead the way?
Well, I think there are loads of ways you can lead the way. So I've given you a heap of the good practice that I was shown, and I bet you there is loads more. You've got the perfect infrastructure that you have created to make neighbourhood working work really well, because all of your hospitals are combined with community services, so you've sussed that problem. You've got 2 really high-functioning mental health trusts. You've got an ambulance trust which is entirely integrated with all of you that covers the same geography. So I think the challenge is really, how do you all work together with primary care now in neighbourhoods to do something very special about how do you keep people healthy for longer? And I think as a region, you've got the opportunity to lead the whole country in how to do that.
And would you say that's probably the biggest challenge the NHS is facing right now?
Absolutely. So we're recording this, aren't we, at a time when flu admissions are unbelievably high. We're in the spike of flu. Mm-hmm. And you think, we actually need a different view about this, that this is an inevitable thing that happens every year, that loads and loads of people get flu. Well, what if we had a completely different campaign where we said we want the whole population to be vaccinated against the flu every summer or early autumn, and we actually put our mind to it? That would end up with, you would hope, a much reduced spike of activity that relates to respiratory illness, and that would make the whole NHS feel better. And boy, millions of people would feel better too, because they wouldn't have got so ill. So we could really rethink something quite big, I think, if we could galvanise the NHS and the public to have a completely different conversation about vaccination. And if we sort it out for flu, we might then find it much easier to do child health vaccinations, where there's lots of issues too.
And how can local systems such as ourselves in the North East and North Cumbria influence national policy to help shape solutions?
Well, I think that's really all about sharing good practice and saying, we have this issue, this is how we work together to solve it, here's the answer, come and have a look. The most obvious one of those is the model that Sir Jim set up in Northumbria, and Bijou has carried on the great work of the critical care hospital and the good use of the rest of the hospitals for rehabilitation and planned care. That is an amazing model that loads of people have come to see and thinking, well, we should do that then. Mm-hmm. So I think you should be really proud of stuff you've done that other people could learn from.
And you've mentioned throughout the podcast some fantastic work that's going on, but what opportunities excite you most about the future of integrated care?
Well, wouldn't it just be amazing if we achieved in the North East that you didn't have 20 years of ill health in your life towards the end, and it was only like 10 years, because we'd actually enabled people to live more healthier lives for longer, so they could actually have a much more fulfilling, bigger part of their life. That, I think, is what would be an amazing achievement, and that's what we should be trying to make happen for the people of the UK, because they pay their taxes to the NHS because they want a really good national health service. Let's give it them.
And on our podcast, a lot of our staff listen to it. So what message would you like to share with NHS staff across our region?
Well, obviously you're totally brilliant. You have this truism, don't you, that healthcare is a people business, right? And AI is never going to replace the people part of care. It will help clinicians deliver better care, but we're going to need everybody working at the top of their game, treating people as well as they can, efficiently and productively. So I did a breakfast meeting for the King's Fund last week on the 10-year workforce plan. And the pitch I gave was, we need to stop worrying about how many of X, Y, and Z specialists do we have and try and plan for that in the future, because that's a fool's errand, because health changes so much so quickly. What we do need to worry about is what it's like for people to be at work, and how do we make the experience of work good. Mm-hmm. And that's all about teamwork. So it's about working with a group of colleagues who you trust and enjoy being with. And it's about the quality of line management for the people in the team, so that everybody can be at their very best all the time. And that is what we have to really focus on. And I Can't imagine it's perfect everywhere in the North East, because it's not perfect anywhere, everywhere. So, but that's what we need to aim for. We need to aim for everyone who works for the NHS feeling that they're safe at work, they're fulfilled at work, they can do their job really well, and that they've got opportunities for developing themselves in the future if that's what they want to do. That's the aspiration we need to get to.
Finally, where can listeners learn more about NHS providers and the work you're doing nationally?
So we've got a great website, and all of the places I've visited, we've written a blog on. So all 42 of them are on the website, and you can find out the good practice in every place. We've also got a great podcast series called Providers Deliver. And we issued a bunch of those in November to go with our conference. And one of them features Tees, Esk and Weir Valley Mental Health Trust and the amazing mental health service that I spoke about right at the beginning. So everyone can go and listen and learn about the great work in more detail that team is doing.
Daniel, thank you so much for sharing your insights and experiences with us today. It's been a pleasure to hear from your perspective on the future of the NHS and the role of collaboration in delivering high quality care. So thank you very much.
Thank you.
Thanks for joining us for this episode of the Providers Podcast. Hit subscribe to keep up to date with the latest news and catch up with what we've been up to on our website and social media pages.